We're for sharing innovative treatments and preventing disease before it ever develops. Learn how our team is working to better care for you on this edition of UVA Health System Radio. Here's Melanie Cole.
While playing sports such as basketball or soccer, it's easy to snag a finger on an opponent's jersey and suffer an injury. Do you need ice or do you need to go to a doctor? My guest today is Dr. Bobby Chhabra. He's chair of UVA's Department of Orthopedic Surgery and is board-certified orthopedic surgeon. Welcome to the show. Dr. Chhabra, explain the injury commonly referred to as jersey finger.
Thank you very much, Melanie. Jersey finger is a fairly uncommon injury, except in certain sports, particularly football or soccer, but mainly football. It's when an individual or player is trying to tackle another player and the finger gets caught on the jersey and then gets hyperextended at the most distal joint. So the finger, while they're gripping, gets forcefully hyperextended while they're trying to make a tackle. And what ends up happening is the tendon that inserts on the bone, the most distal bone in the finger, gets ruptured off of the bone. So you lose flexor tendon function. And it's fairly common in football players.
Are there certain positions that are more susceptible to this than others?
Really, any time someone's trying to make a tackle. So it really, any of the defensive players would be susceptible to this. And the ring finger is the most common. It's felt that it's the finger that's needed most for forced grip, and it's the one that's injured most frequently. And it really, often people just think they sprain their joint and it'll get better on its own. And it often takes a while before they realize that they cannot make a full fist and they can't bend that last joint of the finger.
So that was my next question, was symptoms, because maybe it gets caught, maybe they keep playing, and then it's sore, really sore, and getting sore. What are some of the symptoms that people would notice that would send them to see a doctor instead of just using ice?
A very good question, because you're right. Frequently, these players will keep playing. They think they just jammed their finger or sprained their finger, which are very common injuries. And later on, after the game, after the adrenaline is worn off, they'll notice that they're sore. They may have some swelling and then ecchymosis or black and blue around the distal fingertip and tenderness along the finger, the palm side of the finger where their tendon had been pulled off the bone, so they'd be tender along the course of the finger. And when they try to make a fist, they'll be able to bend the joint closer to the palm, but they won't be able to bend the furthest joint from the palm. And they may not notice that they can do that for some time. They'll think they're just sore. But if they are having persistent swelling and pain along the tendon, the flexor tendon there, and they notice they have inability to make a full fist, it's important, it's imperative that they see a hand surgeon, truly, because these are injuries that are not handled by general orthopedic surgeons or primary care physicians. These jersey fingers always require surgery in the young athletic individual, and normally these injuries occur only in the young athletes.
Tell us a little bit quickly about hand surgeons and orthopedic surgeons. Are hand surgeons also orthopods and vice versa?
That's a very good question, and it's a little bit, it's not as straightforward an answer, but hand surgery or hand, wrist, elbow surgery is a specialty subspecialty and requires fellowship training after you've completed either a full orthopedic surgery training residency program or a plastic surgery training residency program. About 85 to 90% of hand surgeons in this country have completed an orthopedic surgery training program first, and they're board certified in orthopedic surgery. And they've also done an additional year of training in hand surgery, which often includes hand, wrist, and elbow surgery. And then the Hand Society has a certificate of added qualification or a subspecialty certification, which once you've completed your hand fellowship, you can take an exam and have your practice reviewed and be board certified in hand surgery as well. So, for instance, I'm board certified in orthopedic surgery and board certified in hand and upper extremity surgery.
Thank you for clearing that up for us, Dr. Chhabra. So if someone has jersey finger, Do you recommend that they ice while they see the doctor, while they're going through whatever treatment you've decided? And we'll speak about treatments, but is ice something that's going to be the first line of defense, something you want them to do right away?
Well, frequently they may not know the severity of their injury, so ice always helps when you've jammed a finger or you feel like you have injured a joint. Ice will help initially keep the swelling down, and resting that joint so you don't aggravate symptoms will be important as well for a first line of treatment. But ultimately, particularly for jersey finger, and I know we'll discuss this in just a minute, but these require more significant treatment options than just rest and ice.
So let's discuss those treatment options. What do you do for it?
So the one thing that's very important is once it needs to be diagnosed early, because frequently the tendon gets ripped off the bone, and because there's tension on the tendon, because the muscles are in the forearm, the tendon is going to pull back. It's going to pull back, and if it pulls back into the palm, then you have a limited time window to fix that. Really, within 7 to 10 days, that should be surgically repaired. So the tendon is actually retrieved from the palm and attached back to the bone with various techniques, and then requires a very involved therapy program that will last about 3 months. So return to full activities is going to be will not be sooner than 3 to 4 months after an injury like this, if it needs surgical repair. Sometimes the tendon doesn't pull back or retract back that far, and maybe you can wait a little bit longer, a couple weeks, a few weeks to have it fixed. But it's imperative that you're seen soon by a hand surgeon. These injuries are fixed by hand surgeons and those who are certified in hand surgery because they require various techniques. There is a high rate of stiffness if appropriate therapy is not done. And when the results aren't what you desire after treatment, sometimes a second surgery is needed to release scar tissue to allow the tendon to glide so that a full range of motion can be obtained.
Are you splinted after surgery?
Yes, you're splinted in a splint initially, and you have therapy starts usually 3 to 5 days after the surgery, and you do what's called passive motion for a while in most scenarios where you don't actively move that finger, but you use your other hand to bend the tip so the tendon glides a little bit. But you can't do active motion right away because you need the tendon to heal. And if you put too much stress on the tendon, it'll just rip off the bone again while it's healing. So usually more aggressive therapy doesn't start till about 4 weeks, and you're splinted for almost 6 weeks after this injury. You're wearing a splint to protect that tendon repair.
Dr. Chhabra, it's absolutely fascinating information, and you're so well spoken. In just the last few minutes, please, give your best advice for people that think that they may have suffered jersey finger or who want to prevent it, and why they should come to UVA Orthopedics for their treatment.
Thank you, Melanie. If you've injured a finger, the first thing to know is whether you have full motion of that finger. And you're going to be stiff and swollen, so it will be hard to make a full fist and to move every joint. But you should be able to move it once your swelling is better. If you have some ice and it's calmed down a little bit, maybe some anti-inflammatory medications, ibuprofen, Aleve, if you can take that. And you should know within a day or two whether you can move your entire every joint. And for some reason, if you can't move the joint, should be concerned for either a fracture in the finger or a tendon injury. And that's when you should see a surgeon or hand surgeon soon. If there's any suspicion that you have a tendon injury, then you should see your local hand surgeon soon. And as I mentioned, some of these injuries are very time sensitive for surgery. So the sooner you get in, the better, because if you delay surgery for these injuries, particularly if the tendon is retracted back to the palm, if you wait 2 to 3 weeks to have it fixed, then there's a higher rate of stiffness and an overall less than desirable outcome. So if you can't move all your joints, if your pain persists for a couple days, then you should see a hand surgeon very soon. As for UVA Orthopedics, I'm fortunate to work in a department. I've spent my entire career here at UVA. But we were just recently named one of the top 100 great orthopedic programs by Becker's Hospital Review. And we're fortunate in that we have every specialty represented. We have joint surgeons, hand surgeons, joint replacement surgeons, hand surgeons, sports surgeons, spine surgeons. I work at the UVA Hand Center, which has 6 specialty trained hand surgeons. So we have experts in every field of orthopedics that can provide the highest level of care. And I'm also thankful that we were recognized by the Women's Choice Award recently for the National Patient Satisfaction Award. So I feel you'll get great comprehensive care at UVA Orthopedics. You'll have specialists who are fellowship trained in an individual joint or problem, and you'll have the best chance of having the best outcome.
Thank you so much. You're listening to UVA Health Systems Radio. For more information, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening.